Introduce to you our participants, and you'll also see that their names and titles spelling will also be contained in the chat function. First, we'll hear from Dr. Nun Trong, a pediatric cardiologist from University of Utah Health and Intermountain Primary Children's Hospital. Primary Children's is the teaching hospital for the University of Utah School of Medicine. And Dr. Trong is co-leading the study we'll be talking about today. Also joining us are Madeline Dayton, who is 13 years old, Madeline Dayton, who is 13 years old, and her mother, Marilyn Dayton of Wyoming. Madeline Dayton is a study participant, and she and her mother will talk about their experiences with MISC and the study. After their remarks, we'll open the time for questions from the audience. Please submit your questions in the chat function, and be sure to identify yourself and your news organization. You can also find names and titles, again, of our participants in the chat function. And now we'll turn the time over to Dr. Trong.
Thanks. Since we are socially distanced, I'll remove this so that everybody can understand me better, hopefully. Thanks for joining us today. We're pleased to announce that Primary Children's Hospital is co-leading the nation's first long-term study of multisystem inflammatory syndrome in children, or MISC, which is a rare but serious complication of COVID-19 infection. The study is called the Misc study, which is short for long-term outcomes after the multisystem inflammatory syndrome in children. The Misc study is a 5-year longitudinal study that's funded by the National Heart, Lung, and Blood Institute, which is part of the National Institutes of Health. The study uses the framework of the Pediatric Heart Network, which is a National Heart, Lung, and Blood Institute-funded research consortium of pediatric cardiology centers across North America. The Misc study will be conducted at more than 30 hospitals across the United States and Canada. I'm proud to co-lead this study with Dr. Jane Newberger from Boston Children's Hospital. The Misc study comes at an important time. My colleagues and I at Intermountain Primary Children's Hospital have treated dozens of young patients with MISC at this point, and we continue to care for them after their hospitalization. So far, at Primary Children's Hospital, we've treated over 50 children with MISC, and this number continues to grow. MISC is a rare complication of COVID-19 infection that we think is caused by an extreme immune response to the virus. MISC can cause severe illness involving any organ system, including the heart, the lungs, blood, kidneys, or brain. Children with MISC are hospitalized and often require the intensive care unit due to low blood pressure, shock, or decreased squeeze of the heart. MISC also seems to disproportionately affect children of Black and Latinx background. MISC is largely a mystery at this point. We don't know yet what risk factors make some kids with COVID-19 infection develop MISC and others not. Because kids with MISC can be very sick and be in the hospital for days, they may take some time to completely get back to baseline because of fatigue or other symptoms that they may have, even once they're at home. And we may restrict some kids with MISC from participating in sports and physical activities for 3 to 6 months because we don't know yet if there are longer-term effects on the heart, namely scarring of the heart, which can lead to abnormal heart rhythms and potentially death. We also don't know what longer-term symptoms kids with MISC have or may develop, such as difficulty concentrating or chronic fatigue-like illness, which we're starting to see in adult COVID patients. We hope that the Misc study will better help us understand how MISC affects children and young adults over time, and help us more quickly detect, treat, and manage MISC. The Misc study is the first research study to examine how MISC affects the coronary anatomy and squeeze of the heart in a systematic manner over time. The study will also examine the long-term effects of MISC on other organ systems, including the nervous system, lung, immune, and gastrointestinal systems, just to name a few. For me, the study is really exciting and necessary because parents ask me all the time in clinic and in the hospital, what can we expect over time? Or how will my child do over time? Or how will my child's heart be affected in the future? And unfortunately, I don't have a clear answer for them at this point, and the data that we have are very limited right now. However, I hope that in the coming years, we'll have more answers for parents and for my patients. We hope that the data from the Misc study will help us to provide data for guidance and long-term follow-up strategies for these kids and young adults, such as whether or not we even need to activity restrict them in kids who have evidence of heart involvement. The study wouldn't be possible, however, without the help of participating families of children who've had MISC. One of the participants at Primary Children's Hospital is 12-year-old Madeline Dayton of Wyoming. And in October of 2020, Madeline, who's a stellar athlete, had been experiencing fever, rash, headaches, and loss of appetite. One day, she woke up and discovered she couldn't move without much pain. She would soon learn that she had MISC. And you may recognize the Daytons as a family who joined Primary Children's late last year to share their story, to encourage others to take steps to slow the spread of COVID-19. We're pleased that they're joining us today to talk about their experiences with MISC and why they joined the Misc study.
Thank you, Dr. Trung. We appreciate all of your help and all of the medical field right now as you try to conquer this COVID pandemic. And we just kind of wanted to share a little bit of our story. As most people know out there, if they've followed, in October, she did have COVID-19 or MISC. We did not know that she had been exposed to COVID. None of our family, there's 8 of us in our house, none of us had any symptoms. None of us had tested positive. That's why we had never, it was never even the back of our minds that this would be something that she would develop. But it did progress fast. It started out just as flu-like symptoms and then progressed really fast. And she was pretty severe by the time we got her to Primary Children's. And when we were first asked to participate in this study, I never really questioned, I never had any doubts as to why we shouldn't, because this is such an unknown disease in children. And I wanted answers. I was asking Dr. Trung in the ICU the same questions that she was just mentioning. What are the long-term effects? Can she get back to playing sports? When can she be back to normal? And unless they do studies like this and find participants to participate in it, then they can't get those answers. And it's frustrating from our standpoint, because we want to be asking these questions 5 years from now when this study is over. I want to know the answers now, and so does Madeline. But we also know that that there aren't going to be any answers unless we participate in this study and let doctors and researchers find ways that they can help families like us, and hopefully in the future answer questions that we have at this point. So that's kind of why we decided to participate in this study, and we're very grateful for Dr. Trung and for her willingness to go about this research and to help families in our situations.
How are you doing, Madeline?
I'm doing much better now.
Great. And have your symptoms gone away?
Yeah, I still get tired a lot easily, but other than that, everything's gone almost back to normal.
She's still home. We've kept her out of school just as a precautionary. And the one thing that I've noticed as a mother with her is I'm kind of glad that I didn't put her back in school. We've done virtual school. Is the chronic fatigue. Is she does wear out a lot faster than she did before, and I don't think that she realizes that, but there's just little things that she'll do. She's tried to get back to a little bit of activity now. She's been able to go in and shoot baskets with some of her teammates and do a little bit then, but it was within like the first 5 minutes of shooting around that her face just went pale and she was very winded, and that's not like her, even though she's been off for a little bit. But we have noticed the fatigue part, and I don't know that she could get up and go to a full day of school and handle everything yet, because she still sleeps a lot, and I'm blaming it on COVID. I'm hoping it's not the teenage hormones kicking in, but But we're blaming it on COVID for right now. So I don't know how long she can keep this as an excuse, but that's what we're blaming it on right now.
Keep going. Okay. Okay. Well, thank you, Maddie and Marilyn, for sharing your story. And this study is so important. We're grateful to you and other families like you guys who've chosen to participate in the study. Ultimately, our team of researchers across North America hope to enroll about 600 children in the study. And study participants are children and young adults who are less than 21 years old who've been diagnosed with MIS-C. We'll be enrolling children and young adults over the next 2 years at the over 30 participating centers across the country. And we'll be following up with them for up to 5 years. As part of the study, researchers will analyze children's heart function and rhythm, as well as symptoms outside of the heart in the short and long term. And we'll also look for genetic clues about disease risk and outcomes. We'll use this information to create evidence-based treatment guidelines for MIS-C that will help pediatricians and others better identify and respond to children with MIS-C symptoms. The Misc study is part of a comprehensive Department of Health and Human Services and NIH strategy to understand MIS-C and pediatric COVID-19 as quickly as possible. With the Misc study, we're working together with centers across North America in the hopes of narrowing the current gap in knowledge about MIS-C and how it affects kids in the short term and the long term. Thank you.
Thank you, Dr. Trung. And now we'll open the time for questions from the audience. As a reminder, please use the chat function to submit questions for Dr. Trung and the Dayton family. And please include your name and your news organization with your question. Dr. Trung, we have a question. Can you tell us some of the symptoms of MIS-C in children? And is it possible for families to detect this, or do they need to go and have a professional determine whether they have MIS-C?
Yes, so there are symptoms that families can notice at home that may make you seek attention from a medical provider, either your pediatrician or a local emergency department, obviously depending on how sick your child looks. But children with MIS-C have fevers, and they have to have at least depending on what case definition you use, at least 24 hours of fever. And some other symptoms that are quite common in MIS-C are gastrointestinal symptoms like abdominal pain, vomiting, diarrhea that often might mimic appendicitis. Other symptoms have included red eyes, as well as rash, and often just fatigue, not feeling well, generalized malaise. So obviously those symptoms overlap with a lot of other things that probably kids experience frequently with influenza or other common cold symptoms. But kids can be pretty sick. And if you start noticing the combination of things, particularly GI symptoms and rash, red eyes, you should seek medical care. And again, if the child is looking sick, either urgent care in the emergency department or 911 is needed.
Thank you, Dr. Trung. And that looks like it answers Jed Bull's question about variety of symptoms. We have a question from Lisa Roche from Deseret News. Since children can't get vaccinated at this point, what advice do you have for parents who want to protect their children from MIS-C?
Yes. So the only way we can protect kids from getting MIS-C is helping to stop the spread of COVID-19 infection as much as possible at this point. So that includes appropriate social distancing per CDC guidelines, mask wearing, avoiding contacts outside of the family as well in terms of social distancing. So at this point, that is about all we can do. And when the vaccine gets rolled out to broader scope, you know, adults that are able to get the vaccine to get it to, again, hopefully reduce the spread of COVID-19 infection.
Thank you. And this one's from Sean Means from the Salt Lake Tribune. What will the process be for this study, and how often will children go in for appointments? And what will the checkup include?
So a lot of the study is data collection more than anything else, and following these kids long-term by tracking their data. That includes data within the hospital, as well as follow-up appointments. And then after the first year of diagnosis, they'll get an annual phone call from local research study teams to ask how kids are doing or the participants are doing and go through a battery of questions regarding the various organ systems. And luckily, the follow-up for the music study is very much aligned with what many centers are doing across the country with current follow-up with these kids at various time points, namely a couple of weeks after hospital discharge, about 2 months after hospital discharge, and then about 6 months after hospital discharge as well. And so there's really nothing extra necessarily per se involved with the study besides optional genetic testing, again, to look to see if there are genetic factors that may play into risk of severity of disease or outcomes.
Thank you. And this one is from Carter Williams with KSL.com. Can you repeat how many MIS-C cases have been reported at Primary Children's Hospital? And is there a number of how many cases were reported across the country so far?
Yes, so at Primary Children's, we've had at least 50 at this point. And in terms of across the country, the Centers for Disease Control actually tracks the number of cases across the US, as it is a reportable illness at this point. And when I looked in early January, end of December, there were over 1,500 cases across the United States reported to the CDC, and that's about a month lag in terms of data collection from when it was last reported.
This question is from Kimball Benyon at Telemundo. Would the study look at what might be behind the higher prevalence of MIS-C among Black and Latino children?
We do hope that. We hope that it will give us more information regarding why Black and Latinx children seem to be disproportionately affected. At this point, we're unsure if it's just following the epidemiology of who's becoming infected with COVID-19 versus potential genetic factors or other factors related to the development of MIS-C. And so, as mentioned, there is optional genetic testing as part of the study that may help us to get to those things, but we look at various other factors as well. So we hope that it will give us some information on that.
We have a question from ABC4. Are there any common underlying health issues among MIS-C patients? And this is just so he can understand COVID triggers the MIS, how COVID triggers the MIS-C in children.
Yeah, interestingly enough, whereas acute COVID infection often tends to affect people with underlying conditions in both adults and pediatric patients, MIS-C is different in that it often affects kids that are generally healthy for the most part. In the various studies that have been done, some kids that are obese or have asthma have been the more common underlying medical conditions that affect kids with MIS-C, but overall, kids are pretty healthy that get MIS-C.
And we have a follow-up question from the Salt Lake Tribune. Do you have figures on what percentage of Black and Latinx children have been affected by MIS-C?
Yeah, when you look at the CDC data that's updated on the CDC website, they break down the number of cases of MIS-C or the percentage of cases of MIS-C by race and ethnicity. And about a third are African American, about a third are Hispanic off the top of my head. So that's a large proportion of kids with MIS-C.
And from Deseret News, Lisa Roche, do the variants pose a concern about increases in MIS-C cases or in their severity?
At this point, we don't know, partly because MIS-C tends to show up, or kids tend to develop MIS-C anywhere from 2 to 6 weeks, typically, after the exposure to COVID-19 infection. And so we first started hearing about the new strain of coronavirus, I think, back in December. And so we might just be starting to see that, and depending on how quickly it's spread across the country. So at this point, I think it's a little bit hard to say, but people are definitely interested and curious to see if things will change in what we're seeing in either disease severity of kids presenting with MISC or duration of hospitalization or things like that. But at this point, given the time delay in when we often see MISC in reference to the actual exposure, it might take some time for us to see any changes.
Dr. Chung, are there other types of infections that have had this type of impact on a child's heart and lungs, or is this new?
So, interestingly enough, while MISC is a new condition for the medical community, it overlaps with features of many different illnesses and presents in disease severity of similar illnesses, namely things like septic shock, um, what we call viral myocarditis, which is when an infection actually invades the heart tissue itself, or something called Kawasaki disease. And interestingly, some kids with MISC can present with all three types of clinical pictures like that. And so we've used our knowledge on these other illnesses to help us to treat and has helped to guide us how we're treating MISC right now, since we have no evidence-based data at this point. So Kawasaki disease presents with similar symptoms such as red eyes, rash, prolonged fevers, common in kids, and can affect the heart, either more commonly the coronary arteries of the heart, making them enlarged or dilated. Can also affect the squeeze of the heart in rare instances. Things like viral myocarditis can lead to decreased squeeze of the heart, and things like septic shock lead to severe low blood pressures or hypotension from bacteria in the blood.
What is the age range of patients that you're seeing with MISC?
Yeah, so kids with MISC tend to be school age to early teenage to teenage years. So the gamut is wide, but there have been reports of younger infants, toddlers with MISC, and given the CDC case definition, also up to 21 years of age.
It's great. We have no further questions. Dr. Trong, have we missed anything?
I don't think so.
I think we got it all. All right, everybody, thank you so much for coming today. We will follow up shortly in an email with the news release and links to images and B-roll that you can use. Thank you again for coming.
Thank you, everybody. Thanks, guys.